Jay?
What? Can be done here. Here. Philomena.
And following her will be Justice Ouko from the judiciary. After the DCJ, after the acting CJ, we will have Justice Ouko.
When the country is battling the COVID-19 pandemic, having reported at the peak of the third wave of the COVID-19 virus. And of course, there you can see President Uhuru Kenyatta, the First Lady Margaret Kenyatta, there leading other leaders who are currently at State House Nairobi in receiving the COVID-19 vaccine, the Oxford AstraZeneca COVID-19 vaccine that has since been distributed in the country among the frontline workers, who include teachers, who include healthcare workers, and those who have fallen into the bracket of the category that is, being termed as the priority list. Those people who remain on the front line in various spaces. The vaccine arrived in the country this month, and of course it has been distributed across the 47 counties. Healthcare workers have been reporting receiving this particular vaccine. So there you have seen President Uhuru Kenyatta and the First Lady. They have just received a jab. This is coming amid calls for leaders, politicians and religious leaders who fall under the category of the priority list to lead by example by receiving this vaccine, just to eliminate the fears and the misinformation that has been there with regards to this vaccine. And you can see there the president taking the bull by the horn and leading by example to actually receive the jab, to just ascertain and show the country that it is indeed safe, because we have had health officials actually really selling the gospel of how the safety of this particular vaccine, and urging Kenyans who fall in the category of the priority, those who are in the priority list, to just go forth and take advantage of this opportunity. The vaccine has been termed as an added tool in the ongoing war against COVID-19. There you can see the Interior CS, Dr. Fred Matiang'i, getting ready there to receive the jab, the Oxford AstraZeneca COVID-19 vaccine. There you can see Matiang'i there also being among the leaders receiving this particular vaccine, an exercise that is being conducted by the health officials currently at State House Nairobi. This exercise coming just a few minutes after President Uhuru Kenyatta made an address concerning the COVID-19 situation in the country and announcing a raft of measures that the government is putting in place to avert the spread of COVID-19. And he actually just, in his address earlier, he named some 4 counties as disease-infected areas. That's Nairobi, Kiambu County, Nakuru, Kajiado, and Machakos, that are now, as we speak, have been declared disease-infected counties. In these counties, the president announced there's going to be a cessation of movement just to curtail the spread of COVID-19, and of course also adjusting the curfew hours. You can see there the health CS Mutahi Kagwe also receiving the COVID-19 vaccine. And this is just moments after quite tough measures were announced to curtail the spread of COVID-19. There you go. That is the health CS Mutahi Kagwe receiving the COVID-19 vaccine. This is actually an exercise that is currently ongoing at State House Nairobi. So President Uhuru Kenyatta, First Lady Margaret Kenyatta, Interior Cabinet Secretary Dr. Fred Matiang'i, the health CS now you see are among the people who have received this vaccine today at State House Nairobi. And we can also see there the Defense Cabinet Secretary, former Defense Cabinet Secretary Rachel Omamo, they are also receiving the jab, the COVID-19 vaccine at State House Nairobi. This is just a show of solidarity with Kenyans, and also a show of leading by example as the cabinet secretaries and the head of state are leading the nation in receiving this particular vaccine, among the first group of people who fall under the category of those in priority to receive the vaccine. Of course, it's coming at a time when also there was an announcement that those who are above the ages of 58 years are also going to be included in the first phase of the vaccination exercise. This is just coming because according to the health officials, this group of people actually fall under the vulnerable group, and they are highly at risk in contracting the COVID-19 virus. So in this pilot phase of the vaccination exercise, yesterday we saw the government announcing that they're going to be included in that bracket of people who are going to be receiving this vaccine. But it's not for everybody as the in the first phase. It is restricted to those who actually are on the front line in different spaces, and of course those who are highly at risk. It is a vaccine that has been exempted for women who are pregnant, for children, and other people who could be having special health issues, special health cases. So it is going to be issued in phases, and the government is really optimistic about the availability of this vaccine as soon as possible, so that each and every person, or even just a larger group, a larger percentage of the population can be able to receive this particular jab. This is happening because there's been a lot of talk about, people just raising concern about the safety of this particular vaccine, many sharing misinformation about this particular vaccine, especially concerning the news that has been online concerning several side effects of this particular vaccine. And we've had health officials in the country really coming out strongly to condemn those who are spreading propaganda and rumors about this particular vaccine, and just urging those who actually have the opportunity to get it and they're in influential positions to go ahead and get it in public, so that other members of the populace can be able to get that assurance and that confidence that this vaccine is indeed safe. Of course, there's quite a number of people who are still skeptical about it, but it's a journey that just began in this particular month, and the government is really keen on selling the message about this vaccine, and also just marshalling all the efforts and all the resources that are required to ensure that the country gets the vaccine available to achieve what has been termed as the high immunity, to have a substantial number of people in the population getting this vaccine. It's just a step and a boost in the war against COVID-19 in the country, which has really escalated in the country in the last few weeks. The country has recorded quite a number of cases surging over the casualties also surpassing 15 per day as we speak in the last few days of this particular week. So the positivity rate doesn't look very promising, and the way the trajectory of the curve of COVID-19 is going, it's really disheartening. We've had for a better part of this particular week talks about hospitals across the country being overwhelmed, patients who are seeking the critical service in the ICU units actually reporting facing a nightmare accessing some of these services, because hospitals are recording a full capacity of patients who are suffering from COVID-19 related complications. And it is just a warning from the Ministry of Health for Kenyans to take responsibility in their own hands and do what they can in the small corners of the world to adhere to the COVID-19 safety protocols of washing hands, observing social distance, wearing the face mask, and of course just to ensure that you're not part of the numbers, you're not part of the statistics, because going by how we are dealing with this, and according to reports that the country is receiving, the numbers keep surging, and the health facilities are increasingly becoming overwhelmed, and Kenyans are being just urged to take the proactive approach in the war against COVID-19. You can see there Archbishop Anthony Muheria also having received the COVID-19 jab, and of course the healthcare workers, they are really keen on ensuring that this process is seamless. This is coming, like I told you, just moments after President Uhuru Kenyatta declared a raft of measures just to control the spread of the virus. As we speak, Nairobi, Kiambu, Nakuru, Machakos counties have been declared disease-infected counties, and the president talking about a cessation of movement in this particular 4 counties, leaving out the rest, and an adjustment in the curfew hours for these 4 counties. The curfew by beginning midnight tonight is going to begin from 8 p.m. and end at 4 a.m. in the morning. But for the other counties that do not fall in this list of counties that have been termed as disease-infected areas, the curfew will continue as it has been at 10 to 5 in the morning. President Uhuru Kenyatta has also issued a ban on international travel into the country. Of course, no, not really. The international travel into the country shall continue according to existing guidelines, and people who are coming into the country are required to have a negative PCR certificate upon entry. So international travel is actually going to continue, but with strict conditions that people should actually have a negative PCR certificate upon entry. Of course, President Uhuru Kenyatta ordering bans in the disease-infected counties, and of course adjusting the curfew hours, and talking about also how we are going to conduct business in the country going forward for hotels and bars. And there shall be an immediate suspension of physical learning also in learning institutions other than those who are sitting for the examinations. That is according to President Uhuru Kenyatta, who spoke earlier. You can see there Bishop Oginde also getting his jab there. This is just among the religious leaders who have been leading the Inter-Religious Council on COVID-19, and they were there, part of a team that were joined President Uhuru Kenyatta as he made that major announcement on some of the new measures that have been put in place to curb the spread of COVID-19. And of course, learning institutions, like I told you, as it stands, President Uhuru Kenyatta has announced the suspension of physical learning in all learning institutions, coming at a time when candidates are sitting for their national examinations. The KCPE candidates just concluded theirs, and the KCSE candidates are having their examination exercise going on. So President Uhuru Kenyatta has exempted this group of learners from the restrictions on learning institutions, just for them to complete their national examinations. But going forward, we are going to see quite a number of learning institutions closing down for physical learning. And of course, this is until further notice. There was no clear date as to when physical learning is going to resume. So this is part of the measures that were put in place by President Uhuru Kenyatta, which also include, by the way, the places of worship which have been given a chance to continue conducting their services. But this is strictly in line with the Interfaith Council guidelines. President Uhuru Kenyatta there categorically stating that they will only be allowed to have a third of their ordinary capacity. So quite a number of people will be left out, or churches and religious centers will have to improvise on how they conduct their services so that they can accommodate worshippers, but with strict guidelines and the strict adherence to the COVID-19 safety protocols. So what you're seeing right now, in case you're just joining us, are pictures we are getting live from State House, Nairobi. And President Uhuru Kenyatta there and the First Lady, Margaret Kenyatta, have just led quite a number of leaders in receiving the AstraZeneca COVID-19 vaccine. And it was an exercise that came just moments after he has addressed the nation concerning the COVID-19 situation in the country. So President Uhuru Kenyatta there being really talking very firmly about how this situation is going to be controlled in the country, and just encouraging Kenyans to really put in efforts to assist in eradicating the spread of COVID-19 in our country. So those are the pictures you're receiving right now from State House, Nairobi. And part of the measures that we are looking at right now as we battle this third wave of COVID-19 include the fact that if you are a business person in the hospitality industry, all restaurants and eateries in the counties that have been listed as disease-infected counties, which include Nairobi, Machakos, Kiambu, of course, you will be required to offer takeaway services only. Other counties shall continue as they have been conducting business, but with strict adherence to the Ministry of Health safety protocols on COVID-19, which includes social distancing, ensuring that The places are fumigated as much as possible. There are hand washing points at the points of entry and sanitizers wherever necessary, so that we avert the spread of COVID-19. So the counties where there's going to be an adjustment on how those in the hospitality industry conduct business include Nairobi, Nakuru, Machakos, Kiambu, and Kajiado County. Of course, employers have been directed to let employees work from home, save for those who offer essential services. So going forward, there's going to be an adjustment on how the workspace is also looking like, because employers have been directed to let employees work from home, save for essential services. So these are pictures we've been bringing to you live from State House, Nairobi. And right now we just want to resume with our normal program.
Tonight on KBC Channel 1.
Watu wameenda pale, wameamka asubuhi, wamepanga foleni vizuri.
Watu wako wengi. Nilikuwa nakwambia uje mapema. Hakuna haja tupange line si wote. Wewe tu nilipia alafu utaleta huko tutapatana huko ndani ofisi. Na nusu. Acha nihudumiwe nimaliziwe niende.
Unamaliziwa na ngoja unamaliziwa kwani si pia hataki kumaliziwa.
Yaani uko hapo? Yaani kwenye line. Sasa hii ni maneno gani tena? Ni nini inaendelea hapa? Ama line inaanzia na huko pia mimi niende nikasimame huko nyuma.
Wewe mzee hapana bwana. Unajua wengine tumepanda mabasi.
Kwa hakika hii ni tabia ambayo inauzi sana.
Tonight on KBC Channel 1.
Hivyo. Yaani hata natamani asirudi kabisa.
Tizame basi, mimi nikikuchukua wewe, yeye hawezi kufanya lolote.
Jamani, Mungu mshari wewe.
Fanya hivi. Jifiche.
Hapana, sitajificha wewe.
Tafadhali nakuomba. Jifiche hapa.
Akuje tumenyana.
Fanya hivi, sikiza bwana.
Ofanyani.
Navaa nguo mume wangu.
Tonight on KBC Channel 1.
Why would Glenn do this? Why would he go behind my back?
Let me go look for Glenn. Nikae naye chini.
Mimi nilikopeshea pesa yako.
Gani?
Yenye Tifa ndiye alimpatia kakuletea huyu. Usiwahi niaibisha hivyo tena hata kidogo maisani mwako.
Nasema mbona naye tokele dai.
Nika shetani tu kaliniingia.
Kwani nyinyi tu ndio mnaingilia ngwana shetani?
Wanaume inakuwa ngumu sana kuelewa.
Much more than losing your job. Don't worry. I'm not threatening you. You know, I'm just cautioning you.